Hi, this is my longer video on shoulder dislocations.
So again, here's the socket, here's the ball. Usually there's a trauma to the arm bone that causes this thing to come out. It can come out the front or the back, most commonly the front. Once it comes out, the ligament that goes from the ball to the socket never heals. Some people, because of their muscular strength and their activity level, will not come out repeatedly, and those people don't need surgery. For the people that do come out repeatedly, it is recommended that you do early surgery rather than later surgery, because every time this ball comes out, you can lose a piece of that socket. The socket is very shallow anyway, and if you lose too much bone, you get what's called bone loss instability. So the normal socket looks like this. The labrum gives it a little added depth. The ball is much bigger than the socket, like a golf ball and a golf tee. Every time you come out, it can chip bone off here or create a dent here. And the more that happens, if you lose more than 13% of this bone, and you only option is to reattach the ligament here, the failure rate for this soft tissue surgery is very high. So normal Bankart repair is done arthroscopically through tubes. Normally we have all this bone here and we reattach the ligament here where it's supposed to be. But if you come out 20 times before you come and see me and you've lost more than 13% of the bone, you might need a much bigger surgery called a Latarjet surgery with screws. And that's a much harder surgery to recover from. So as a result, we recommend not necessarily surgery for first-time dislocators, but certainly if it's come out twice, if you're young, if there's a big piece of bone on the initial dislocation, we'd recommend earlier surgery. We also repair torn labrum in the back. This is mostly weightlifters and offensive linemen. The primary symptom of that is pain. Sometimes the radiologist will read a slap tear, which is a superior labral tear. I urge you not to have surgery on those unless you're a baseball pitcher in college or in the professionals. This is a very common finding on MRI. It's a normal finding in most people. It is the source of much misery if it's operated on. It's probably not causing your symptoms, and I highly recommend you stay away from surgeons who are recommending repair of slap tears. Thank you.